12 weird signs that you have liver damage. In this video, we're going to take a deep dive into 12 weird signs and symptoms of liver damage. These are very important signs to be aware of because you can stop this disease from progressing and getting worse, as your liver is capable of completely regenerating with a little help. Liver disease is a condition that affects over 25% of the global population, and this number is growing rapidly. Many people believe that liver damage only comes from excessive alcohol consumption, but the truth is it can also be caused by eating too many sweetened, sugary, or processed foods and drinks. Consuming excessive omega-6 vegetable oils, fast food, frequent use of painkillers like acetaminophen or ibuprofen, and viruses can also cause liver damage and hepatitis. Having too much elemental iron in the body can be a problem, as well as toxins from the environment, such as pesticides, plastics, petroleum, and so on. So, if you want to find out if there are problems with your liver, watch this video until the end, as we will also explore some natural home treatments to cleanse the liver and prevent further damage. Disclaimer: this video is for educational purposes only, so please consult your doctor if you have any medical conditions. Sign 1. Pale stools. The first sign of liver problems is pale stools when using the bathroom. Your liver releases conjugated bile acids to help digest fats from your food, which gives your stool its normal brown color. However, if you have fatty liver disease or liver damage, this bile stops flowing properly through the bile ducts, causing your stool to become lighter, paler, or clay-colored, and it may float on the toilet water due to the undigested fat, which makes it buoyant. Sign 2. Poor night vision. The second sign is poor night vision. If you notice that it becomes much harder to focus or see at night, especially in low-light conditions, this may indicate a deficiency in retinol or vitamin A. The bile from the liver helps absorb vitamin A, which in turn helps the rod cells in your eyes adapt to different levels of light. However, having liver disease leads to a lack of bile, preventing proper absorption of vitamin A and causing what we call night blindness. This can also indicate a congested gallbladder, especially if your eyes also feel very dry, sore, irritated, or gritty. Sign 3. Swollen right foot. The third sign is swelling in the right foot. When blood is not flowing properly through the liver, it can become swollen and enlarged, putting pressure on the portal vein. This leads to fluid or water retention in the legs or feet, and when you press your finger on the swollen area, it may leave an indentation. If you notice that your right foot and ankle are more swollen than the left, this is an extremely common sign that you may have liver damage. You might want to use a natural remedy to improve its function, but we will discuss more about liver cleansing later in the video. Sign 4. White eyelid growths. Coming to sign number 4, we have white eyelid growths. Another strange sign of liver damage is the appearance of white or yellowish growths around the eyelids. These are small cholesterol deposits that build up under the skin because the liver isn't breaking down cholesterol properly, causing it to back up into different areas of the body. Sign 5. Right-sided pressure. The fifth sign is a feeling of pressure or pain on the right side of the rib cage, especially after eating. This can be a sign that you have liver disease, as an inflamed or congested liver puts pressure on the surrounding tissues, causing discomfort. Bile from the liver can turn into sludge due to liver damage, clogging the small tubes connected to the gallbladder and causing this sensation of pressure and pain around the ribs. It can also put pressure on the phrenic nerve, causing muscle tension and pain in the right shoulder region. Sign 6. Purple and red spots. When the liver is congested, inflamed, or damaged, it produces fewer proteins that are needed for normal blood clotting. This means you may bruise more easily, and quite often unusual purple or red bumps may appear as a rash on the skin, as well as small red patches. This often occurs around the lower legs or arms and is caused by poor blood circulation triggered by liver disease or possibly diabetes. Sign 7. Cracked heels. Another strange symptom is the appearance of cracked heels. Your body uses vitamin B3, commonly known as niacin, to keep skin cells strong, smooth, and moisturized to prevent damage. However, if you have liver disease, your body uses up its vitamin B3 reserves to help repair the liver, leaving less of this nutrient available for other functions. This causes the skin on the soles of your feet and heels to begin cracking. This can be overcome by increasing your intake of vitamin B3 and addressing the root cause of the problem, which is fatty liver disease. Sign 8. Itchy hands and feet. Another symptom of liver disease is a constant urge to scratch the palms of your hands or the soles of your feet. This condition is caused by a buildup of bile acids under the skin because the liver is not filtering these acids properly. This causes histamine levels in the blood to rise, leading to an itchy reaction. Sign 9. White or clubbed nails. The 9th sign is completely white nails or clubbing. If your nails start to lose their pink color and turn all white, or if they take on a rounded, clubbed, or bulbous appearance, this may indicate serious liver damage or another underlying health condition preventing oxygen from reaching the nail matrix. It was discovered in the 1950s that 8 out of 10 people with severe liver scarring had all white nails. Sign 10. Dark urine. The 10th sign is dark urine. Your liver's job is to break down old red blood cells, which contain a yellowish pigment called bilirubin. If the liver or gallbladder becomes damaged, this pigment can start to build up in the body and be excreted through the urine, causing it to turn a dark orange, amber, brown, or cola color. This happens because your liver isn't breaking down the pigment properly. This symptom can also be caused by certain medications that weaken the liver, such as antibiotics, sleeping pills, or birth control pills. Sign 11. Yellowed skin. When the liver isn't working properly and isn't filtering bilirubin from the blood, this pigment can also begin to change the color of your skin. This causes a yellowish tinge to the skin called jaundice, which is a sign of severe liver damage, such as hepatitis, cirrhosis, drug, or medication poisoning. Therefore, if you notice these signs, please consult your doctor. Sign 12. Spider veins. Finally, the 12th sign is spider veins. These appear as small red dots with extensions of blood vessels that resemble spider legs on the skin. These blood vessels become damaged because the liver isn't doing its job of filtering excess estrogen. High estrogen weakens the blood vessels in the veins, causing them to dilate and become visible on the skin. If you have one or more of these symptoms, it's highly recommended to visit your doctor and ask for an ultrasound test. This is a very simple, non-invasive test that uses sound waves to create an image of your liver and its network of blood vessels to determine if there are any fatty deposits building up. How to reverse liver disease. Fortunately, the liver is one of the only organs in the body that can heal and regenerate completely. As I previously mentioned, the liver goes through 4 stages of damage. First, it becomes clogged with fat, then it becomes inflamed and begins to develop scar tissue called fibrosis, and then it progresses to a more severe and life-threatening stage called cirrhosis. However, fortunately, the liver can regenerate and heal completely when you improve your diet and use the right remedies. Let's go through the most important steps to reverse liver damage. 1. Clean up your diet ***. Cut back on sugary, starchy, and flour-based foods like bread, biscuits, sweets, ketchup, pancakes, pasta, soda, etc. A fatty or damaged liver is sensitive to fructose, which is fruit sugar, just like it is to alcohol, so it's important to stop drinking fruit juices and alcohol entirely. 2. Eat sulfur-rich foods ***. Eat plenty of sulfur-rich and bitter foods, such as leafy greens, artichokes, radishes, garlic, broccoli, Brussels sprouts, kale, cabbage, mushrooms, pasture-raised eggs, wild salmon, and other oily fish, walnuts, onions, scallions, and broccoli sprouts. Sulfur-rich foods help strip away fat from the liver by boosting glutathione levels and detoxifying toxins. 3. Organic coffee with turmeric ***. Drink 1 cup of organic coffee brewed at home every morning and add 1 teaspoon of turmeric. The polyphenol found in coffee and the phytonutrients in turmeric help reduce scar tissue formation in the liver and repair damage caused by alcohol, drugs, or fructose. Also, drink at least 1 liter of high-quality mineral water throughout the day to help thin out your blood and assist the liver in producing bile to break down any fatty deposits. You can add freshly squeezed lemon or lime juice to improve toxin filtration in the liver. Additionally, Include as many liver-cleansing herbs and spices in your diet as possible, such as ginger, turmeric, cinnamon, dandelion root, milk thistle, medicinal mushrooms, green tea, and cloves. 4. Intermittent fasting ***. Consume all your daily calories within a 6-hour window, allowing your body to fast for 18 hours every day. I recommend eating all your food between the hours of 12 p.m. to 6 p.m., but you can adjust this window to suit your lifestyle. This is called intermittent fasting or timed eating, which significantly improves liver health by reducing inflammation and increasing insulin-like growth factor, a hormone that helps prevent fat accumulation in the liver. Fasting also stimulates autophagy, where the liver recycles old damaged cells and proteins to regenerate new healthy liver cells. 5. Avoid inflammatory oils ***. Stop consuming all inflammatory seed oils such as corn, cottonseed, canola, rapeseed, soy oil, cheaper processed olive oil, margarine, etc. Instead, start eating anti-inflammatory fats like extra virgin olive oil and virgin coconut oil in your own home-cooked delicious recipes, as these have proven liver protective properties. To clean out fatty deposits and reduce inflammation inside the liver, take a purified bile supplement in the morning on an empty stomach. You can use TUDCA, purified bile salts, or a digestive enzyme blend that contains ox bile on the ingredients list. These not only help eliminate fat from your liver, but also prevent the formation of gallbladder stones. If you're serious about repairing your liver, there are other vitamins and supplements that can also be used. If you'd like to learn more, click on the video appearing on the screen now for more information. Once again, thank you so much for watching my video today and for your support. Wishing you great health, wealth, and happiness.